Yes, good morning. This is Dr. Soria, and we have a lady named Lorena. She's very young, as you can see, and we are going to do today an interesting combination of an intermediate depth peel. In this case, we are going to use this substance. It's called TCA, trichloroacetic acid peel. But besides this, which is very interesting, we are going to do, this is the third, perhaps fourth patient in the world that we will use subcutaneously injections of human embryonic stem cells. This is a new technology that comes from India. Dr. Gita Shroff is the inventor. And then we are going to start stimulating the dermis underneath with the cells, stem cells, and we are going to erase the skin from the outside with the peel. That combination per se should be interesting enough to have a new and interesting way to treat the skin that it has never been done before. So you are going to be the fourth patient we do this, okay? How about that? Okay. Okay, so now we are using with a gauze 20% TCA, trichloroacetic acid, after we have cleaned the skin with surgical soap and with ether. And now we are testing the degree of discomfort and pain with the 20%, and it sounds or it looks okay, but I need to obtain a white aspect that we call frosting. Light peels are done in beauty salons, like glycolic acid, for example. Intermediate depth are in medical offices like this, and deep peels using phenol or carbolic acid has to be done in an operating room with an anesthesiologist present because it's very painful. So we need to have an anesthesiologist. No pain? A little bit. Okay. Such of chemicals is you can put them inside of the hairline and will not damage the hairs. If we use lasers and the laser beam touches one hair, it destroys them, evaporates them. I mean, it can grow back again, but with the laser you have to stop like a few millimeters before the hairline, so you end up always with a treated and not treated area. So that's why in our hands we don't like lasers. But it's only a tool. The doctor has to make the decision what type of tool he is going to use to treat the patient. It's not the patient's decision, it is the doctor's decision. Okay. Okay. May I have another this? Sure. But let's put it to 20, which we have already there. So far so good. Perhaps if the horizontal lines of the forehead are like this, you go this way, perhaps. But no, the key is just to obtain an uniform whitish color of the skin, the frosting, and it's just keep frictioning and frictioning. And you go to the jawline here.
You do avoid the lips?
We don't touch the mucosa of the lip because she may have some blisters. So we don't touch it. Try not to touch it. Most of the lips we do it with fillers in order to plump it out and make it a bit more fuller. And you do areas, first the forehead, then side of the face, then the other side, then, but you don't change to the next area until you get the uniform frosting that we are talking about. So in general, peels modify the structure complexion of the skin and make it look younger. Lifters, like threading or surgery, get rid of the redundancy of skin. And fillers change the shape of the face, balance the face. And most of the time, just about every patient needs the three things done. Not all together in one go, but eventually, if you want to look your best. What happens is that nowadays people try to avoid the operating room and the anesthesiologist and the cutting, but in some cases is necessary. When there is a lot of redundancy of the neck tissues, you have to go for surgery. You know, most of the clinics right now all over the world, now by the dozens, that advertised stem cells, most of them use the cells of the patient to do the stimulation or the regeneration. And that is okay, but those cells, although they are stem cells, they are as old and as healthy or sick as the patient is. So it's not the ideal source of stem cells. You need younger, you need much younger. So you can go and get the cells from umbilical cord, placenta, and they are 9 months old. But the youngest from them all are 3 to 4 days old. And that technology, only India has it. And now this clinic in Tijuana is the first one in the world, after India of course, that has got that technology. Took us almost, what, 3 years to be able to do it? Okay, now these, Lorena, are your human embryonic stem cells all the way down from India. So you are going to have some Indian in your blood. Okay, they come at a certain temperature, and once they come, we get a much comfortable needle. And then we warm it a little bit. They come at minus 20 degrees. So we have to bring it back to the body temperature, around 37. She already had a previous injection into the arm, like a testing to see if there is no allergic reaction or whatever. And then you see that they are a little bit. There you go. Little injection. Okay. You tell me if it bothers you. Me dice si te molesta mucho. This is just like Botox. Préstame una gasa. Okay. Okay. Every time you put a little needle underneath the skin, it's a bit uncomfortable. It's like Botox, exactly like Botox. But Botox goes into the muscle, and this one goes subcutaneous, not into the muscle. Okay, so let's go to the other side.
So you spread them throughout the face?
Yes. You can actually, we are, ponle aquí una presión. We are concentrated with 1 cc. Let's see how they react with 1 cc in the future, because we don't have like a certain amount. Okay, we don't have a certain amount already established. So we go with 1 cc, how they look in 6 weeks. Then we can go to 2 cc's or whatever is necessary. Intramuscular injections of something powerful against pain. We could have an IV infusion. Even in very, very scary people, I could bring in the anesthesiologist to sedate them lightly but that would add up to the bill. And most people can take a bit of pain instead of
Pain.
Pain on the wallet.
a pain on the wallet.
Not the same.
Just to give you an idea, here, Mr. Cameraman, what we did a few months ago. This is the before and after, using the stem cells from the blood, from her own blood. Can you see it? Yeah. So if my educated guess is that if with her own blood we can get these results, we should get them better with the Indian cells. We'll see. We'll soon see.